wanted to talk about Lindsay Clancy. What if one of the most disturbing criminal cases in recent memory isn't just a crime story? What if it's a medical story? And what if, as uncomfortable as it is to ask, the system we trust to protect vulnerable mothers is being tested in a way it has never been tested before? Today, we're going to talk about the Lindsay Clancy case. We're doing this because medicine, psychiatry, and criminal law collide, and that's what's happening in this case. And we should all be paying attention to this. I'm not really going to speak about it casually as I might some other cases, only because this one sort of touches on things I have direct experience with. I've told you guys before, I'm a physician assistant. I've practiced in the medical field for over 20 years, and I've practiced in various settings, including an emergency room and a level 1 trauma center. I screened patients, and I saw what would happen when SSRIs, which are acronyms for sustained serotonin reuptake inhibitors, when SSRIs, I saw what happened when they were helpful. But I also saw what happened when they weren't helpful. I practiced before they had the black box warning on SSRIs that was added for teenagers. And I watched as teenagers were activated and became manic, and suicide rates went up. And there was a lot of misunderstanding as to what was going on until they realized when you prescribe these SSRIs to people who have a predisposition to bipolar, you can make them manic. And when people are manic, they do things that will increase risk for everyone, including themselves mostly. And so that's why, in case anybody wasn't familiar, black box warning is on all SSRIs now. But we can't ignore the reports that indicated Lindsay Clancy was under psychiatric care, that Lindsay Clancy was prescribed medication for postpartum mental health issues. When a medicated postpartum mother commits an act this catastrophic, the medical system is part of that conversation, whether people like it or not. Not because medication is always going to cause harm, and not because the psychiatry is the villain, but it's because the medicine is not risk-free and pretending it does not protect women. The problem is the lack of care taken when these medications are prescribed. These medications can be life-saving for the right people. But when people like physicians or PAs or nurse practitioners become like a fast food takeout, would you like fries with that? Because someone comes in and asks directly for an SSRI because they're depressed and their mother's on it and their sister's on it, and somebody just flippantly writes it without screening them for mania, history of suicidality, and all of these things. And we all know that this happens every single day, over and over and over again. I know it happens because I watched people do it. I'm pointing out something that I feel this case is going to highlight, and that we can no longer ignore about the medical system.